Hey everybody, this is Dr. Matt Joosse at Joosse Family Orthodontics in Williamsburg, Virginia. I wanted to show off this amazing case that we did with braces, and this is Jack. So you can see that Jack is not exactly wild here at the start of his treatment about showing off his teeth. He was actually really embarrassed by his teeth. He never wanted to smile, and that's why he was seeking treatment. So let me show you a little bit more about Jack. All right. This is Jack's teeth when we started. So a couple of things to note here. When you look right here, the upper tooth is behind the lower tooth, and we call this an anterior crossbite. This prevents the teeth from functioning in the way that they should function. So it's really important that upper teeth become to the outside of lower teeth for the bite to function well. So that's one of the big things that we wanted to fix. Additionally, these upper front teeth overlap the lower front teeth excessively, and because of that, Jack's already starting to wear down some of his lower front teeth. Not something you want to see in your teenage years. So one of our big objectives is to try to what we call open the bite, make less overlap of the front teeth, so that Jack's teeth can be preserved into his older age. Of course, things are very crowded and the alignment is off, and so there's lots and lots going on here. But let me show you some of the more interesting things about Jack. Okay, here's his lower teeth. You can see that we are crowded, so we definitely have crowded lower front teeth. But the lower is nowhere as crowded as the top. So these are his upper teeth, and you can see that there's a tooth up here in the upper right. That tooth belongs between these two teeth right here. So an entire tooth belongs in this little bitty space right here. On the left side, we have this whole tooth that belongs in the space between these two. And so you can see that the upper is very, very crowded. Well, I had a feeling that we could do this without taking out teeth. Now, sometimes when mouths are very crowded and there's not space for teeth, sometimes we'll talk about extraction of teeth as an option. Of course, that's not something anybody wants to go through. Excuse me. And if we can avoid extraction of teeth, then that's a win for everybody. So I thought that we could do that with Jack, and I want to show you how we avoided extraction of teeth. All right, here's a look at the right side of Jack's bite. Again, here's this tooth coming in right here, and this tooth belongs between these two teeth right here. Obviously, there's not space for it. But if we look at some of the back teeth, you can see, so again, this canine tooth belongs right here in line with this line. But there's also some room to push some of these upper teeth backwards. So this line right here should line up with this one. And so if there was a mechanism by which we could push these upper teeth backwards and these lower teeth forwards, hey, we can start to open up a little bit more space right here. On the other side, we have this tooth coming in. This is the canine tooth, and it belongs right in this space. So you'll see that with these lines that I've drawn. So the line on this canine belongs lined up with this line, and this line right here belongs lined up with this one. So again, we want a mechanism of action to push these upper teeth backwards and these lower teeth forwards. Here's how we achieve that. We use something that we call a D2 appliance, and this is something that happens before we consider braces. We put this little bar on the upper teeth, and we ask Jack to wear a rubber band from up here to down here. And what that's doing is as he wears that rubber band, it's pushing these upper top teeth backwards, and it's creating space for this canine to come in. So again, you can appreciate how much space was opened up just from pushing these upper teeth backwards. And you can see that this canine tooth is coming down where it belongs. So again, that line belongs right here. And we haven't even touched this canine tooth with any braces, and it's already closer to where it belongs. On the other side, the same thing happened. We put the bar on, he wore a rubber band from right here to down here. It pushed these upper back teeth backwards in the mouth, and it opened up space for this canine tooth. So you can see that space opened right here, and that's the space that we're eventually going to need to continue to open for this canine tooth to come down where it belongs. So again, that line should come and meet this one, and these two lines should be even. Here's where we finished. This is pretty much a perfect result of a bite in the back. And you can see that these lines line up perfectly. So we got things exactly where they belong. On the other side, it looks just as good. Here's our result in the front. These teeth look beautiful. So we got them really nice and lined up. And here's Jack's smile at the end. And he's still not smiling big, but this is a much bigger smile than where he started. And that was the best thing about Jack's treatment, was just watching him have the confidence to really be able to smile again. And he's a pretty good kid along the way too. So I really, really enjoyed my time with Jack. You can see as we celebrated, his brace is coming off right here. Jack is my one mixed martial arts guy in the practice, or at least that I'm aware of. And so we'd always talk about mixed martial arts. And so here's Jack and I getting ready to spar. And look at that big smile that he's got. Jack, I am super proud of you. I knew that if you could put in some work with that D2 appliance, if you could help create some space, I knew that we could avoid tooth extraction. And you did it perfectly. And the results are really paying off for you. I am so happy with your smile. I'm just so happy that you have the confidence to show it off. And I want you to just go out there and change the world, man. We're so proud of you, and your smile's looking great. Thanks so much, Jack, and thanks for listening.